Good afternoon. Welcome to Baby Steps Childbirth Classes. My name is Lisa Scully. I am a registered nurse and certified in inpatient OB. I received my master's in nursing with an emphasis on education, and that is what I'm here to talk to you about today. This class mirrors the patient education class I teach in the 3rd and 4th weeks of prenatal classes for patients. I provided you with the handouts of the slides as well. Who here thinks it matters to your work as a nurse what the patient knows and doesn't know? Did you know that when you went to nursing school, one of your most important jobs as a nurse is to educate your patients? They'll ask, "What are you doing? What is this pill you're giving me? Why can't I get up by myself? When do I go home? Why do so many people have to come in here? I'm a private person. Do you have to do that?" Here are my objectives for our class today. By the end of this class, you will be able to identify a method of calculating a due date, identify 2 monitors used specifically in labor and delivery, recall 3 different methods of pain management, and recall the stages of pregnancy. Our job as nurses is to advocate for and communicate with our patients. We are with our patients at the bedside, helping them use the restroom, making their pain go away, helping lower their blood pressure, encouraging and motivating them. During labor and delivery, a woman and her support persons are going through a life-changing event. When they leave the delivery room, they're adding another person to their family. Of course they're scared, especially if you're the woman on the left. So, I'm a childbirth educator. What do I teach? I teach patients and their families all about the process of pregnancy, labor, delivery, postpartum, infant care, and breastfeeding. We're going to start out with a game. Everyone get out your phones or computers. Yes, I'm telling you to get out your phones. I play this game with my patients at the end of their classes. Go to the website kahoot.it. This is a live game we can play together. Type in the game pin 64439. Pick a name for yourself and let's get started. Question 1. How many stages of labor are there? 2, 1, 4, or 3? 4 stages of labor, that's right. Who has the longest pregnancy? A dog, an elephant, a human, or a giraffe? An elephant, between 18 and 22 months to be exact. How many weeks is a pregnancy? 36 weeks, 38 weeks, 40 weeks, or 9 months? It should be 40 weeks. And then how many centimeters is a woman when she delivers vaginally? 8, 12, 10, or 15 centimeters? That's right, 10 centimeters. Great job. Now that I have your minds thinking all things pregnancy and labor, let's get started. To begin, let's talk about pregnancy. Anyone know a way that we can calculate a pregnancy due date other than an app or chart? Nagel's rule is one way we can calculate someone's due date based on the first day of their last menstrual period. So, a woman states her last period started on November 1st, 2016. If we add 7 days to this, November 8th, and then subtract 3 months, August, we have a due date, August 8th of 2017, that's right. What does a woman look like in labor? How do we know what the baby's heart rate is or how often the mom is contracting? We connect mom to a few monitors throughout labor to watch her progress closely. We monitor vital signs closely as well. This means her heart rate, blood pressure, respiratory rate, temperature, and as well as her pain level, the 5th vital sign. Throughout labor and delivery, mom will have many monitors connected to her. It is important as the nurse to instruct a patient about what each monitor does and why it is important to be monitored in these ways. 2 new monitors for this group might be the fetal heart rate ultrasound transducer and the toco dynamometer. The ultrasound transducer is a special monitor placed on mom's abdomen. The first monitor on the left is this electronic ultrasound transducer for monitoring the heart rate. This transducer sends out continuous sound waves. As the heart beats, the sound bounces off the fetal heart rate and is displayed like a graph. Can anyone tell me another device similar to a toco-dynamometer? That's right, a sphygmomanometer. Both of these devices measure pressure. So the toco, as it is referred to, contains a disc that responds to pressure. As the uterus contracts, the monitor shows a bell curve demonstrating the strength of contraction. You can see both monitors on this mom's abdomen, as well as patterns that the monitor creates visually on the computer. One major component women hear so much about is pain during labor. This is one of the most important topics to discuss with women expecting a child. Pain is not only physical, but can be mental as well, causing a lot of fear and anxiety. How bad will it be, or how long will it last, are some uncertainties that patients have as labor begins. There are 3 main ways to manage our pain during labor and delivery. These include relaxation and breathing techniques, IV pain medicine, and epidurals or spinals for delivery of pain medication. Finally, let's talk about the process of a vaginal delivery and the steps from the beginning of labor until the stages of labor are completed. As you might expect, the first stage of labor begins with regular contractions causing the cervix to begin to dilate. Throughout the dilation process, a woman remains in this stage of labor. And did you know that the 4th stage of labor ends not when the baby is delivered, but lasts for 1 to 4 hours after the delivery? Let's take it step by step. The first stage of labor, from the beginning of labor until the cervix is 10 centimeters or fully dilated. Let's talk about how to incorporate a visualization for us and for patients in childbirth education classes. The cervix is not readily visible to the naked eye, so we can visualize the cervix only with a speculum, which is not comfortable during labor, especially. The dilation of the cervix is estimated based on a scale of centimeters, and to visualize the scale, we look at fruit. Now, you may not see the fruit the same after this, but with the pointer finger and the middle finger, the provider uses to palpate this cervix. So, with a blueberry, we have 1 centimeter. Now, with a strawberry, we have 2 centimeters. Here with the side of a lime, we have 4. And then with a lemon, we have 6. 8 centimeters is going to be represented by an orange, where we can just reach it. And then 10 centimeters we're going to have as a grapefruit. So the cervix goes from 1 centimeter to a whole 10 centimeters before the baby can be delivered. It's pretty amazing. So the second stage of labor, from complete dilation until the delivery of the baby. Our third stage of labor, from the delivery of the baby until the delivery of the placenta. And then finally, the 4th stage of labor is from the delivery of the placenta until about 4 hours later, while the mom's recovering. So it is essential that throughout labor and delivery, a woman is made comfortable. Think through this analogy with me. When a rabbit is in the wild, preparing for delivery, the mother rabbit must feel safe. If the rabbit feels threatened at all, she'll remain in labor for a longer time until she feels safe and comfortable enough to deliver her bunnies. While a woman may not be searching for a safe location to deliver, any fears or anxieties she may have in fact prolong her labor. It is important for women to feel comfortable and at ease during labor. She should think very seriously about who will help her accomplish those feelings during labor and ask them to be present for delivery. Now I have a short case study for you to complete in a group. Groups may be 3 or 4 people. Sit together and discuss this scenario in group of questions. We will discuss each in about 10 minutes. Also, before we leave today, please fill out an evaluation. Patients, fellow staff, and yourselves are professionals in our own learning styles, so it's our job as educators to teach in a simple, understandable, and thorough manner. Please answer the questions and leave any suggestions you may have. These are our references for today. And finally, thank you for listening, and I hope you learned so much. Now go out and educate your patients.